am Dr. Puneet Rana Arora. I am the founder of CIFAR Fertility and IVF and also senior consultant. We at CIFAR firmly believe in providing a holistic advice to our patients or couple who walk to us seeking fertility. This holistic treatment includes preparing them for this treatment, which includes providing them the right advice of their nutrition, their health. So to make this possible and to understand this better, I have with me Mrs. Prerna Madhok. Welcome, Prerna. Prerna is a metabolic health coach who firmly believes in this concept which CIFAR believes in. Prerna herself was diagnosed with PCOS at some point. So Prerna will also discuss that aspect with all of us today. But also not only PCOS, there are a lot of common questions which are often asked when a couple comes to us as to what is the right diet for them, what they should eat more, what they should avoid. Is there any role of insulin in the outcome of their success of achieving pregnancy? So all these questions I'm sure Prerna will be able to answer for all of us. So let's listen to her and understand. Welcome, Prerna.
Thank you, doctor. Thank you, ma'am. So, ma'am, when it comes to women health, I think we get a very raw deal, especially now that, we have PCOS, endometriosis, menorrhagia, metrorrhagia, so much going around that a woman gets overwhelmed that what is happening, how can I take care of it? We keep shifting from one doctor to another doctor in the hope that this condition will go away. What happens is, there are so many factors that are playing in at that point of time. You were going to doctors, you were doing your Google researches, and everyone is giving you a standard answer. And you are doing all those answers, but yet you are not achieving anything. This was my story as well. Back in 2006, I was diagnosed with PCOS, and the first gynecologist I went to, because I was told by my mom that no, if you're having extreme period pain, you should get an ultrasound done, you should go to a gynecologist. Fair enough, I did. Now this gynecologist told me, this is a very common thing. You can take birth control pill or you can take hormonal pills. I was not ready to take pills back then. And I said, no, there needs to be a cause for it. Please give me a cause why this has happened, because I was never a junkie. I would always eat healthy food as, what the doctors say, eat a balanced meal. But for everyone, a balanced meal is different. So that balanced meal was seemingly for me not balanced. It was really not helping my body, and it was not helping my PCOS to go away. So when I was shifting doctors, they were all giving me that, do these yoga asanas, add flax seeds, add omega-3. But in what quantity, how much? You can't keep stressing your system by continuously snacking as well. And I think that was my turning point, that no, there has to be a reason why this has suddenly come up. I was a healthy child, I have been healthy, I have been into exercising, so what's going wrong? And a couple of years ago, a lot of my friends I would see are struggling with gynecological issues, something or the other. And when I dug deeper, I realized that it's not just balanced nutrition or, the whole concept of eat well, move right, stay fit, which is so flawed, I believe now, that it does not tell either a man or a woman that what you are eating is wrong. It is not working for you. So I did a course which really opened my eyes, and I did this course from D-Life, which is all about metabolic health, which has really transformed my life, and it's helping me transform the life of other people, including my friends and family. And this course taught me that you need to eat real food. You do not, even if you're saying balanced diet, no, there's no such thing as balanced diet, it's balanced nutrition. So if you get nutrition from your food, you don't really need synthetic vitamins. You don't need synthetic supplements, like we say. So yes, getting the right nutrition for the body, then counter it with managing your stress levels. So important for us. Whether it is work, whether it is home, anywhere. And then we have the environmental stress, the noise pollution, air pollution, which obviously we have no control over. But things like our exercise, our diet, our bodies, sleep, which we often negate. Now with these OTT platforms, I see people will binge watch. They will compromise on their sleep, and then they will wake up fatigued. I haven't slept well.
So I think, I would just interrupt you here, Prerna. So very important point to take is that yes, we do take n number of diet plans,
Yes.
and maybe something which can help us keep healthy.
Yes.
But at the same time, it is important that the stress, mental health, and adequate sleep is very important. Even if you're taking those diet plans, it is important because the balanced diet will become balanced if you are eating right, no doubt about it. But in a way, you keep your body right as well with adequate sleep and completely mental, free of any kind of a stress and anxiety
Yes.
problems.
And also, I believe that I have seen a few cases where the women and men are over the age of 35. They're wanting to conceive, and that is the time they rely on fertility apps. They are good as a calendar to show you, but really, at that age, I feel that it is so important for the couple to understand their bodies, what is happening. Not relying on those apps. Mark your calendars, yes, I will say. But if you have health issues, fix them. Obesity, we now see, is strongly related to increased infertility. Then there is thyroid. Then people are having either no sperm count or very low sperm count, or the quality of sperm is so bad. Likewise for egg, the ovarian reserve starts going down. So after the age of 30 also, nowadays, I have started telling my clients that please get these checks done, get your LH done, get your AMH done, understand if there's a tube blockage, understand what you can do about it. Because that is one age where then, you need to give your body at least 3 to 6 months to heal.
Absolutely.
You cannot really expect the damage that has been done to reverse in a month.
And I think the diet will get better absorbed if
Yes.
you are stress-free, if you had adequate sleep. Because if you keep on taking the diet and you don't have these two components in it, that diet may not get absorbed, and you may feel that this balanced diet is no longer a particular balanced diet for me. It's just because the other components have to be added to it.
Absolutely, and also because we are biodynamically so different that one diet may work for me, but it may not work for someone else.
So what about the insulin and PCOS? Would you just highlight something on that, Prerna?
So when I did this course from D-Life, that was the time I realized that insulin has a very strong connection with PCOS, with endometriosis, erectile dysfunction in men, low sperm production. When I'll give you a brief of what insulin is. So the hormone basically, which is created by the beta cells of the pancreas and helps transform food into glucose for energy to our body. When the cells start resisting that is when the blood glucose increases, and the cells tell insulin, okay, we don't want it. We get resistant to you. We don't want any more of this thing coming, and that is when insulin starts manifesting either as diabetes or as PCOS or any other health issues that we are seeing nowadays. There is a direct connection between PCOS. Most of the women who are diagnosed with PCOS have a very high insulin level. So the one marker which is really not checked is fasting insulin, on which we stress that please check. Anything more than 6 is a danger, because that means that the woman or the man is in that zone where they can get all these issues and where they will get all these issues.
So by danger, Prerna means to say that it can aggravate your symptoms of PCOS, not like danger to life,
No.
but it can aggravate your symptoms of already existing PCOS. So it's good to check your fasting insulin levels.
Yes, and then PCOS is one condition, Dr. Puneet, where we know that it's linked to diabetes, cardiovascular diseases, infertility. I remember the first gynae had told me, it's PCOS, okay, you might just end up with infertility. And that is not what a patient is looking to hear. They're looking for solutions on how you can help, not that, okay, you're soon going to be infertile. So, insulin here plays a very, very important role.
Any diets you think which are high in insulin, or which you should avoid, or which you should take in case you have altered insulin levels?
A diet which is very high in carbs is the first one that will give you a spike. So when we are trying for a baby, we work as a unit, both the husband and the wife. We need to check their levels, check how they are metabolically, and if there are any health issues that they are facing, fix them first. Because it is this hormone which then sends a signal to your brain that yes, this body is now metabolically healthy, can provide a safe environment for the embryo to grow and give a good pregnancy, a healthy pregnancy. Because we need to acknowledge insulin as being, I say, that the most important hormone. How? Because at one point it's causing all these disasters in us. At the second time, in a pregnant woman, it's also helping her body grow. Like the breast tissues are growing. It is increasing her ability to add more fat to her body. The placenta is growing. When the women will deliver, it's giving her all the energy. Lactation. So all these things, the insulin is playing a vital role.
Yeah. So very important. So very nice information, Prerna.
Yeah.
Thank you so much for that. So just kind of before we end, it's a diet which you would like a couple or individual men and women to have when they are planning, and a particular diet which you would like to avoid. Anything you would like to mention on that?
Yeah, I would like to say that not a diet, but a balanced nutrition. When I say balanced nutrition, I mean that you should first be able to analyze your plate and understand what are you eating. Is it all carbs that you're eating, or do they have any balanced healthy fats, any proteins on your plate which are helping that new body grow inside you? Because yes, the mother is the primary carrier of the child, but we cannot say that the father's body will not be taken. But once the mother conceives, we tell the mother that please have all your nutritious food on your plate, which is healthy fats, protein, very low carbs, vitamins, supplements, omega-3, which is so essential, DHA, which will all come from sardines, salmon, your vitamin D3, which is required for the baby. You get it from your food. Very few foods have it, but eggs, sun, walk. Then when it comes to food, I also say folic is very important for the baby's growth. Vitamin A, just so important to avoid miscarriages.
So vitamin A, and I would say moderation, because especially in the first trimester, we have to be very careful.
Yes.
What you have in kind of we try to sometimes avoid if there is a bad obstetric history as well.
Right.
Vitamin E is, I would say, can compensate in pregnancy instead of vitamin A. So I think what is important, what I could gather from what Prerna is saying is, it's the completeness. You need to eat everything, right? It's not that one meal you should kind of have it more than the other. Even carbs are important, but they should not override your proteins and good fats.
Right.
I think that's what I could get from what Prerna is saying.
And get your fruits in place,
Place.
get your vegetables in place. You need that fiber.
So
also.
what about the vegetarians? I know you said that sardines and all the fish have good omega-3, but somebody who's vegetarian, what they can have?
They can
in
have
replica?
walnuts, they can have their seeds, pumpkin seeds, we have sunflower, flax we have.
Yeah, so I think that's something which you can compensate if you are a vegetarian person.
Yes, and if you're a vegetarian, if you're not able to get everything from your diet, please do not miss on your vitamins and the supplements which your doctor is giving you, because it's all for you and your baby which is growing inside. And most important is also hydration. I see people complaining of constipation, and hydration is just so important when you're pregnant. It really helps. Also probiotics.
Yeah. So very
So
important. Yeah. So I think it's important probiotic hydration. I would agree. But then again, emphasizing on the fact that this diet is going to work much better if you have adequate sleep and if you are stress free.
Yes.
Because this is all about metabolism. What you are eating should go into your body. It's just not like you have a plate full of everything, nutrition and a balanced diet, but it's not getting absorbed. There is no point in that as well. So this is all about having a diet which is obviously metabolically very rich, but it should go into your body well. And Prerna, I think from my side, I'm more or less done. But if anything you think you want to convey and add on to anything,
yes,
please.
I would like to add on that while you're pregnant, you should avoid sugar-laden foods, junk foods, ultra-processed foods. They will really deplete your essential nutrients and minerals in the body. And also avoid mercury-rich fish.
Yes.
And raw salads
tuna.
also is like
Tuna has got a lot of mercury.
Yes, and we also ask our clients to avoid raw salads cause of poisoning, salmonella poisoning. But really, just eat a healthy food. Make sure you are calm. Do your meditation. Sleep well. That is the time when your body will really heal and help you. And thank you as well.
Thank you.
Thank you so much.